Climate change is now taking a toll on the rise of cases of malaria and dengue, and the same protocols apply like every other year. We have to ensure that even if we disinfect water bodies, drains, stagnant drains, these kind of locations, we have to make sure that we use environmental friendly insecticides. We cannot afford to be using the more difficult, the more detrimental infectants that can cause harm to the population subsequently. So we've taken all necessary care. Like in the past, we are partnering with the ASHA workers, who are the first respondents in every health crisis in any part of the country. We had said that we would increase kits for testing to ASHAs, because we've seen that late reporting of fever for a prolonged period is usually the cause for casualty due to malaria or dengue. Now we have to ensure that this is again communicated and re-communicated to the public at large in all local dialects. It was very unfortunate that in the last 2 years, about 14 deaths of malaria alone were reported in the state of Meghalaya. We are now looking at ways and means to ensure that this casualty is not as alarming as it was in the last 2 years. And surprising enough, it's usually the younger, under 13 age target that is usually the victim of such deaths related to malaria, especially. In our state, I don't have the latest numbers of today, but we are constantly alerting our systems to ensure that enough awareness is created. Now what tends to happen is that under 18 possibility that they expose themselves likely to later night or later evening activities, and it is this group which is the most vulnerable, and yet they don't know it. So we are trying our best to ensure that we create this awareness, and we have already prepared enough messaging through various mediums, whether it is hard copies, through flyers, or jingles on various radio fronts, or even through the television and the social medium. We hope that these messages are not quickly fast forwarded, which is usually the practice of especially young gamers and young netizens who don't like to listen to any message that comes their way. I hope that this time the population of the state of Meghalaya will be more informed, because this is a very, very dangerous occurrence that we have seen happening in the last 2 years. So the department will go all out to ensure that we even engage with influencers, social media influencers, and our medical team is on the job, and I hope that all of that will result well, and we will not see this casualty caused due to malaria. Things are much better, as I remember from the recent travel that I did to at least the 36 constituencies in one Shillong parliamentary seat. And I've seen that sanitation is something that is slowly getting addressed and redressed. Our CHC, PHCs, health centers, village health organizations have all been alerted to ensure that whatever sanitization problems that are there, even in those locations, they need to be dealt with cautiously and be handled immediately. most important is self-restriction. Citizens have to be in a habit of familiarizing themselves with the various redressal systems. In the plain areas especially, it is highly recommended that you should sleep under a mosquito net. I hope that citizens will not forget these good practices that we have constantly packaged through the years. And of course, early testing when fever persists. That's very, very important for all of us. And I hope these messages go across accordingly.